Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Mr. Morgan. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Morgan. It's good to see you today.
Hi, Doctor. Thanks for seeing me.
You're welcome. So, I understand you're here today because you've been experiencing some symptoms that might be related to hay fever. Is that right?
Yes, that's correct. I've been having a lot of sneezing, itchy eyes, and a runny nose for the past few weeks. It's been really bothering me.
I see. How long have you been dealing with these symptoms, Mr. Morgan?
It started about a month ago, and it seems to have gotten worse over time. I've never had allergies like this before, so it's all new to me.
That's understandable. Allergies can sometimes develop later in life. Have you noticed if these symptoms get worse at certain times of the day or in specific locations?
Yes, especially in the mornings when I go outside, and it's definitely worse when I'm in the garden or near trees.
That makes sense. It sounds like you may be dealing with seasonal allergic rhinitis, more commonly known as hay fever. This condition is caused by an allergic reaction to pollen from trees, grass, or weeds. Have you been exposed to these allergens lately?
I've been spending a lot of time outside recently because of the nice weather, and I think that's when it gets the worst.
It's quite common for people with hay fever to have flare-ups during certain seasons, particularly spring and summer, when pollen levels are higher. Do you have a history of any allergies in your family?
Yes, my mother has hay fever and my brother suffers from asthma. I guess I might have inherited it from them.
That could be a factor. Allergies often run in families. Let's take a look at your symptoms. Your nose is quite congested, and your eyes appear a bit red. This is typical for hay fever. Are you experiencing any other symptoms like coughing, wheezing, or a sore throat?
I've had a bit of a sore throat in the mornings, and sometimes I cough, but not too much. Mostly, it's the sneezing and itching that bother me.
The symptoms you're describing are common with hay fever. The sneezing, itching, and runny nose are the result of your immune system reacting to pollen, as if it were a harmful substance. The body releases chemicals like histamine, which cause inflammation and irritation in the eyes, nose, and throat.
That makes sense. It's just been so uncomfortable. Is there anything I can do to make it better?
Yes, there are a few options for managing hay fever. First, avoiding allergens when possible is key. I'd recommend keeping windows closed during high pollen seasons and limiting outdoor activities when pollen counts are high. Wearing sunglasses can help protect your eyes when you're outside.
I've been trying to avoid it as much as possible, but sometimes it's hard, especially when I have to go to work.
Understandable. In addition to reducing exposure, there are medications that can help. Antihistamines, which block the effects of histamine, can relieve symptoms like sneezing and itchy eyes. Nasal sprays such as corticosteroids are also very effective in reducing inflammation and congestion. Would you like to try one of these?
I've heard of antihistamines. Do they make you drowsy?
Some older antihistamines can cause drowsiness, but newer ones tend to be much less likely to have that effect. I can recommend a non-drowsy antihistamine that would be safe for you to take during the day. Nasal sprays typically don't cause drowsiness, but it's important to use them as directed for the best results.
That sounds good. Are there any other treatments I should consider?
Another option is allergy shots, or immunotherapy. This is a longer-term treatment where small amounts of allergens are injected over time to help your body build up a tolerance. It's usually recommended if symptoms are severe and other treatments aren't effective.
I didn't realize there were so many options. I'll try the antihistamine and nasal spray for now and see how that goes. How long should it take before I feel some relief?
You should start feeling better within a few days of using the antihistamine and nasal spray. If your symptoms don't improve, or if they worsen, we can consider other options. It's also a good idea to monitor your symptoms and keep track of any changes, especially as the pollen levels fluctuate.
Sounds like a good plan. Thank you for the information, Doctor.
You're very welcome, Mr. Morgan. I'll have the nurse give you the prescription for the antihistamine and nasal spray. If you have any questions, or if your symptoms don't improve, don't hesitate to reach out. Take care, and I hope you start feeling better soon.
Thanks again, Doctor. I'll follow up if I need anything else.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Dr. Wheeler. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Langston. I'm Dr. Wheeler, an infectious disease specialist. It's nice to meet you.
Hi, Dr. Wheeler. Nice to meet you too. So, I was told you'd be explaining a bit more about what's causing my symptoms.
Yes, I will. First, I'd like to go over some of your recent symptoms and medical history to make sure I have all the details. According to the report, you recently began experiencing headaches, fever, and muscle weakness after being bitten by a stray animal. Is that right?
Yes, that's right. It's been about a week since I was bitten by a dog while I was on vacation. I thought it was healing fine, but then these symptoms started, and I've also felt unusually anxious and restless.
I understand. It sounds like you've been through a lot, and it's good that you came in as soon as you noticed these symptoms. When you were bitten, did you receive any medical care or vaccinations for rabies?
No, I didn't get any shots or anything at the time. I thought it wasn't too serious. I just cleaned the wound and put a bandage on it.
I see. Unfortunately, some infections, like rabies, can progress even if the wound itself appears to heal. Rabies is a viral infection that affects the nervous system, and it's primarily transmitted through bites or scratches from infected animals. Symptoms typically begin mildly, but can progress rapidly if left untreated.
Oh, wow. So, do I actually have rabies?
Based on your symptoms and history, rabies is a strong possibility. Rabies infections are rare but can be fatal if untreated, especially once symptoms begin. We will run tests to confirm, but we need to act quickly. Early treatment is critical in managing rabies.
I had no idea it was that serious. What are the next steps?
First, we'll give you a series of rabies post-exposure prophylaxis PEP injections. These include both a rabies immunoglobulin and a rabies vaccine, which are designed to stimulate your immune system to fight the virus. The immunoglobulin provides immediate protection, while the vaccine will encourage your body to develop a longer-lasting immunity.
And will the shots stop the virus completely?
In most cases, if the treatment is given promptly, yes. However, because rabies can advance rapidly, the timing of treatment is crucial. Since you were bitten a week ago, we're on a tight timeline, but the vaccine series has been effective even when started later.
That sounds reassuring, but are there any risks or side effects?
Generally, the vaccine and immunoglobulin are safe, though you might experience mild side effects like soreness at the injection site, fever, or fatigue. Serious reactions are rare, but we'll monitor you closely for any signs of complications.
Okay, and what happens if I don't take the treatment? Is there any chance the virus will just go away on its own?
Unfortunately, no. Once rabies symptoms appear, the disease is almost always fatal if untreated. The virus targets the nervous system, leading to severe neurological symptoms, such as confusion, seizures, and eventually coma. This is why early intervention is critical, and rabies PEP is highly effective at stopping the virus before it reaches the central nervous system.
That sounds really scary. I definitely want to go ahead with the treatment then. Is there anything else I should know?
It's a good choice to start treatment as soon as possible. I also want to advise you on monitoring your symptoms and maintaining hydration. Rabies can sometimes cause anxiety and restlessness, but the medications we'll give should ease that over time. And in the future, if you're ever bitten by an animal, especially a wild or unvaccinated one, seek immediate medical attention, even if the wound looks minor.
Absolutely. I won't take any risks next time. And thank you for explaining all of this. It's a lot to take in, but I feel more at ease knowing what to expect.
You're welcome, Mr. Langston. I'm here to support you through the process. We'll get the first injection started now and schedule the rest over the next few weeks. I'll also have the nurse provide some resources on rabies prevention and what to do if you encounter wildlife again in the future.
I appreciate that, Doctor. Thank you for helping me understand what's going on.
Of course. I'll check in with you regularly as we go through the treatment. You're in good hands, Mr. Langston, and we'll work together to make sure you stay healthy and safe.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a healthcare researcher discussing disparities in healthcare access with a community leader. Now read the question.
So, we've looked into various factors that impact healthcare access across different populations. Often, we see that racial, ethnic, and socio-economic groups face significant challenges, which can affect their overall health outcomes.
So, does that mean some communities are just not getting the care they need?
In some cases, yes. For example, lower-income areas often have fewer healthcare facilities, and even when available, the quality of care might not be the same as in more affluent areas.
I see. But is there anything we can do to start improving this situation?
Well, yes. We're actively working on programs to make healthcare more accessible and to ensure quality standards are met across the board. By promoting health equity, we hope to close some of these gaps.
Now look at question 26. You hear a podiatrist explaining the treatment of a patient with onychographosis. Now, read the question.
She'd been experiencing discomfort for several months and struggled to manage these nails herself. I first assessed the extent of the nail growth and curvature. Given the thickness, I decided to carefully grind down the top layers of the nails and reshape them to a more manageable length and shape. This approach relieved her discomfort significantly, but ongoing care will be necessary to prevent further complications. She will need to come in for regular podiatric checkups to maintain her nail health.
Now look at question 27. You hear a nurse explaining essential techniques for wound care. Now read the question.
Good afternoon, everyone. Today, I'm going to explain the essential techniques for wound care and proper dressing changes that we will be following from now on. In the past, wound care procedures varied significantly from one nurse to another, leading to inconsistencies in patient outcomes. Often, wound care was performed without sufficient communication with the patient, which sometimes caused confusion or anxiety for them. As many of you know, we have had reports of delays in wound healing and patient complaints about discomfort during dressing changes. The main reason for this new protocol is to prioritize patient-centered care by involving them actively in the process, educating them about each step, and addressing their concerns during the treatment. By doing so, we aim to foster better healing and ensure patients feel more secure and informed throughout their recovery.
Now look at question 28. You hear two colleagues talking about a training program. Now read the question.
So, what did you think about the training on CPR and emergency response, the one from last Wednesday?
I thought it was quite informative, but it could have covered a few more advanced scenarios. For instance, I appreciated the section on the changes in CPR guidelines, because those are updated frequently. It was very practical to review that.
Agreed. What did you think of the part on basic resuscitation techniques?
It was quite fundamental, obviously, but considering the range of experience in our team, I think it was good for some of the newer staff who haven't had as much practice with emergency response.
True, I hadn't really thought about it that way before, but now that you mention it...
Now look at question 29. You hear two nurses discussing the discharge process for patients. Now read the question.
Hi, Sophie. Can I ask you something about discharges?
Sure, Mark. What's up?
I'm helping a patient get discharged, and I want to make sure I've completed everything correctly. Have you done the new discharge documentation process?
Yeah, I went through it yesterday. It's meant to be straightforward, but it took a bit of time to get all the forms together.
Did you have any issues with the forms or the checklist?
Not really. The checklist was long, but I got through it. Just make sure to double-check that everything is signed and dated. Why are you having trouble?
Well, I keep getting reminders saying I've missed a step, but when I check, everything seems to be there. It's really confusing.
Did you call the admin support team to see if there's a glitch?
Yeah, they said everything looked fine on their end, but I still get the notifications. I'd rather not have to go through the whole checklist again.
You really shouldn't have to. Maybe just email the discharge coordinator to let them know you've completed everything. They should be able to verify it and stop the reminders. Now look at question 30. You hear a trainee nurse receiving feedback from her tutor about a patient discharge she has just completed. Now, read the question.
With the patient. I think I could have explained the discharge instructions more clearly. I went over them, but I think I could have checked if he understood everything. Yes, that would have been ideal, but it's great that you recognized it. Communicating clearly and confirming understanding is so important, especially at discharge. Thanks. Overall, you did well with organizing the paperwork. You ensured the medication list was up to date, checked that the follow-up appointment was scheduled, and reminded him of the dietary restrictions noted in his plan. Yes, I made sure all the instructions were included. And you could have encouraged the patient to ask questions if they were unclear, but it's good that you documented everything thoroughly and signed it off. Thank you. I'll work on improving that next time.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen.
Extract 1. Questions 31 to 36.
You hear a presentation by a specialist renal nurse called Joanna Clark, who's talking about her work with kidney disease patients. You now have 90 seconds to read questions.
My name's Joanna Clark, and I'm a specialist renal nurse dedicated to helping kidney disease patients understand and manage their condition. Today, I'd like to tell you a bit about the type of work I do, and particularly about one of my patients. Let's call him Tom, who was recently diagnosed with kidney disease. I'll share his story to illustrate the type of challenges we face in managing this condition. Before I get into Tom's case, let me give you some background about kidney disease itself. It's quite a common condition, affecting around 10% of the adult population in the UK, though many people may not realise they have it. Chronic kidney disease, or CKD, develops gradually over time and often has no symptoms in the early stages. By the time symptoms appear, the kidneys may already have sustained significant damage, making treatment options more limited. This is why early detection and intervention are critical, and one of the main goals of my work is to raise awareness of the signs and symptoms of kidney disease, like high blood pressure, fatigue, or swelling in the legs. Now, let me tell you about Tom. Tom is a 55-year-old man who initially came to his GP complaining of unusual fatigue and swollen ankles. He works in a physically demanding job and had always considered himself healthy, so he was a bit taken aback when his GP suggested testing his kidney function. Like many people, he wasn't familiar with kidney disease and didn't think he was at risk. But a blood test showed that Tom's eGFR, that's the estimated glomerular filtration rate, a measure of kidney function, was lower than normal, prompting his GP to refer him to a specialist renal clinic. At the clinic, Tom went through further testing, including urine tests, blood pressure monitoring, and an ultrasound. These confirmed that his kidney function was declining and he was diagnosed with stage 3 CKD. For Tom, the most challenging part wasn't the tests themselves, but dealing with the emotional impact of the diagnosis. He felt healthy otherwise, so learning that his kidneys were in decline was a big shock. When I met Tom for the first time, he was understandably anxious and full of questions. I explained the stages of CKD to him, from stage 1, where there's mild kidney damage, to stage 5, which is kidney failure. I also clarified that while CKD is a progressive disease, the rate of progression can vary greatly from person to person, depending on factors like lifestyle and management of underlying conditions such as diabetes or hypertension. In Tom's case, we identified high blood pressure as a likely factor contributing to his kidney issues. One of my key roles with patients like Tom is to help them understand the lifestyle adjustments that can make a difference. I explain the importance of a kidney-friendly diet, which limits salt, protein, and certain minerals like potassium and phosphorus. Tom found the diet restrictions a bit overwhelming at first, especially as he's always enjoyed a lot of meat and salty foods. But after talking it through and getting some guidance from a dietitian, he gradually started making changes to his eating habits. For patients with CKD, another vital aspect of management is keeping blood pressure under control. High blood pressure can worsen kidney damage, so Tom was prescribed medication to help manage it. I advised him to keep track of his blood pressure at home and to aim for regular physical activity to support his overall health. He found this advice helpful and has been checking in regularly with me to discuss his progress. As CKD progresses, some patients may eventually require dialysis, a treatment that helps filter waste products from the blood when the kidneys can no longer do so effectively. I introduced Tom to the idea of dialysis, though he isn't at that stage yet. I find that many patients feel apprehensive about the concept of dialysis, which is understandable. For Tom, I emphasized that dialysis is not an inevitable outcome for everyone with CKD. With the right management, there's a chance he may never need it. What I've found in my work is that the psychological aspect of managing CKD is just as important as the physical. Patients like Tom often need someone to talk to, someone who understands what they're going through and can help them process their emotions. I make sure that patients know that we're here to support them, not only in clinical terms but in coping with the life changes that come with kidney disease. For Tom, this support has been invaluable. He says he feels less alone knowing there's someone on his side. In my experience, community clinics like ours are crucial in helping CKD patients manage their condition over the long term. We monitor their health, provide regular advice, and encourage them to stay proactive about their well-being. Ultimately, our goal is to empower patients to make lifestyle changes that support kidney health and to give them the tools they need to stay as healthy as possible for as long as possible.
Extract 2. Questions 37 to 42. You hear Dr. Carter giving detailed presentation on lifestyle-based interventions for type 2 diabetes. Now, read the questions. You now have
I'm Dr. Carter, a specialist in endocrinology with a particular interest in lifestyle-based interventions for type 2 diabetes. Now, while we know type 2 diabetes is often managed with medication, research and clinical experience increasingly highlight the power of lifestyle changes, specifically in diet, exercise, and weight management to control blood sugar levels. Many patients believe medication alone will manage their diabetes. But lifestyle changes play a critical role in not only controlling the disease but also in preventing its progression and associated complications. Today, I'll share some insights on how these changes work and offer an example from one of my patients. First, let's talk about diet. A lot of people think managing diabetes only involves cutting out sugar. but it's far more complex than that. A balanced, low-glycemic diet that includes lean proteins, fiber-rich vegetables, and whole grains can stabilize blood glucose levels and prevent spikes that lead to complications over time. It's especially important to avoid refined carbohydrates, things like white bread, pastries, and sugary drinks, as these are quickly converted into glucose. Studies show that such dietary changes can reduce A1C levels by as much as 1% to 2%, which is clinically significant for diabetes management. People often overlook the impact of what they're eating on their long-term health, but for someone with type 2 diabetes, diet is the first step towards stability. Exercise, too, is often underestimated. It's not just about burning calories, it's about improving insulin sensitivity, so that the body can use insulin more efficiently. For people with type 2 diabetes, this can mean the difference between needing more medication and achieving stable blood sugar levels with minimal medication. Ideally, we recommend at least 150 minutes of moderate intensity activity per week. That might sound daunting, but it's achievable with simple lifestyle adjustments, like walking after meals or even doing household chores. Every bit helps in reducing blood sugar levels and supporting cardiovascular health, which is especially important given the higher risk of heart disease in people with diabetes. Weight management is the third critical element in managing type 2 diabetes. There's a strong association between obesity and insulin resistance, and just a 5 to 10% weight loss can result in significant improvements in blood glucose control. However, we know that weight loss isn't easy, particularly for individuals with diabetes who may have had long-standing weight struggles. For this reason, I emphasize small, realistic changes rather than drastic diets. We often introduce behavior-based strategies, like mindful eating, which help patients develop a healthier relationship with food and enable them to sustain changes over time. Now, all these lifestyle changes might seem overwhelming to a newly diagnosed patient. Take David, for example, a patient of mine who was recently diagnosed with type 2 diabetes. He's in his early 52s and came to me feeling anxious about his diagnosis, worried it would limit his lifestyle. David was particularly surprised when I recommended that he avoid processed foods and prioritize exercise, as he assumed that simply taking his prescribed medication would be enough to control his condition. But he quickly saw the difference lifestyle adjustments made when he committed to a regular walking routine and began cooking more meals at home. Within 3 months, David noticed improvements in his blood sugar levels, and he felt more energetic overall. Another critical point we discussed was blood glucose monitoring. David was initially resistant, feeling that testing his blood daily was an inconvenience. However, I explained that regular monitoring helps patients understand how their bodies respond to different foods, activities, and stress levels. When David started monitoring his levels more frequently, he began to notice patterns, like how his blood sugar would spike after a high-carb meal, or how a short walk after dinner helped keep his levels steady. This gave him the confidence to make informed choices and avoid situations that could lead to dangerous fluctuations. I think it's crucial for patients like David to understand that type 2 diabetes is a progressive condition, but progression isn't inevitable. Lifestyle changes can delay or even prevent many of the complications we commonly see, like nerve damage, vision loss, and cardiovascular disease. By taking an active role in managing his condition, David reduced his dependency on medication and took back control of his health.
That is the end of Part C. You now have 2 minutes to check your answers.